All right, everybody, we're going to go ahead and get started. Hello, and welcome to today's webinar, Reviewing Your Contract and Negotiating a Better One. We at Weatherby Healthcare are thrilled to have you join us for this informative overview of the physician contract landscape from the eyes of Contract Diagnostics. Contract Diagnostics is the only nationwide consulting company that specializes 100% in physician contract reviews. Since its inception in 2011, they've served tens of thousands of physicians in every specialty in every state, including many Weatherby locums physicians. At Weatherby Healthcare, we believe in creating win-win situations for healthcare providers and the institutions that they work at and that we work with, and that means that contracts should reflect that philosophy as well. So with that, we're proud to introduce to you today's experts, founder John Apino and Director of Physician Education, Dr. Catherine Sarnosky. And you guys can just take it away from here.
Thanks, Madison, and thank you everybody for joining. I'm John and Dr. Catherine, and again, we're happy to join. We were talking before everybody hopped on about our educational division, and I was telling Madison that we started this company 10, 12 years ago to help people, and it's these kinds of talks that get us back to our core. So we appreciate all of you joining. We know your time is valuable, and of course, I'm looking forward to the presentation and answering any questions that you all have afterwards. But to that end, Dr. Catherine can kind of give a little bit of background on herself and why she is the best to give this presentation to you all. And I'm looking forward to listening in and then helping with any Q&As. And definitely do send all your Q&As in either through the chat or or save them until the end, and we'll do our best to answer every single one. But again, thanks for joining, and we look forward to discussing this tonight.
Thanks, everybody, for joining us on a Wednesday night. We appreciate you being here. We hope you find this really useful. Thank you, John and Madison, for the intro. Just so you guys here again, we are with Contract Diagnostics. I am a practicing OBGYN who also helps out as the Director of Physician Education with Contract Diagnostics. We specialize in physician contract review. That is all we do all day, every day. And my role is to help educate you on the language and terms behind the contract, give you some ideas for negotiating the contract tonight, talk about them more in the context of a locum setting as well. And to be a good resource for you, I'm one of your colleagues. I go through this every day as I'm looking for jobs too, from private practice to academics to locums, employed, and in between. I've done it all. So I am here to be a resource for you as well. So hopefully we'll answer a lot of questions as we go through this. Of course, it's comprehensive, but we're never going to touch on everything. So we do leave time for a Q&A at the end. It'll be about 35 minutes of content, and then that should give us a solid 20 minutes for the Q&A. So feel free to put those in the Q&A chat box, and we will get to those at the end, and we'll answer anything afterwards if we can't get through them all tonight. So to jump right in, oops. Tonight, we're going to be going through all of the sections of a contract that we deem to be some of the heavy hitters for you, define some of those terms, understand what they look like in a locums agreement. This applies to any level of training. So this is meant to be helpful if you're a resident still looking for your first job, fellow looking for your first job, or if you are an attending, you've been out in practice, maybe you're thinking about locum tenens, just trying to make this applicable to all. So from the start process through the contract process, these are all opportunities for clarification, understanding the job better, negotiating some of the terms. So it starts with the site visit, might have a letter of intent. We'll certainly be talking about the contract, and then renewal if you're somebody who is staying at a practice and interested in adjusting terms within a couple of years or a certain amount of time at that stay. The site visit, I just want to highlight here what you would expect for a normal job and then what you might expect for a locums job and how those could differ. So the site visit is your first opportunity to really get to know the location, the team, the resources, ask as many questions as possible. I have a few photos up here because I have worked all across the world essentially, but I have photos of Guatemala, Steamboat Springs, Colorado, where I worked, a rural site in Washington State that I actually worked with, Weatherby. Each of these resources each of these locations has very different resources. And so going on site is a great opportunity for you to, one, bring your family if you're traveling, moving with anybody, get to know the schools, the trails, the community, the gyms, whatever matters to you, the food scene, all that good stuff, where the nearest airport is, whatever you need to know. And then when you are on the job side, look at what your team is like. Who's going to be part of your team? Do you have an MA? Do you have a nurse? What kind of resources are you used to having if you work in a procedural or surgical setting? Are there certain instruments that you like to have at hand that give you your best outcomes? If they're not available, what does it take to get those? These are all the types of questions that you can ask. Those can be applicable to a standard employed job all the way through a locums job, those types of questions. And we do a lot of, I'll mention this a couple of times just to remind you guys, we have a ton of free resources available on our website. John and I and a couple others have written a lot of blogs that we have out there. And we've put together some great PDF resources, all free to you. Whatever you want, let us know. We're happy to share them. There's one called Job Diagnostics Q&A that gives you a list of questions that you can ask about a job, because it's so easy to get to an interview and have them say, what questions do you have? And you just totally freeze up and don't know what to ask at the moment. So we put together a pretty dense list for you to work off of so that you have somewhere to go with your questions. And then maybe you'll think of some that are more specific to you once you see that. One thing that might be a little bit different for a locums job is generally you're not going to be doing a site visit in person because the need tends to be a little bit more urgent. You are maybe not interviewing at all, or you're doing a phone or a Zoom interview. I've done everything as simple as I had no interview whatsoever. I just showed up. I kind of had an idea from my my locums rep what to expect, to full-on Zoom interviews with the CMO, CEO, program or department chair, you name it. So there can be a variety, but most of the time you're not actually going to be interviewing in person. But it doesn't mean you don't want to ask all of those good questions. Sometimes it's nice when you're on Zoom or on the phone, you can just have your notes app or your Microsoft Word open and have all those questions and just drill through those. And it seems like casual. They have no idea that you're referencing anything. So still feel free to ask all of those questions because you want to feel comfortable in the position that you're joining. The letter of intent on this left side of the screen is generally more applicable to a employed job or an academic job. We'll see this in about 1 in 5 offers for physicians, and it's generally a 1, maybe 2-page summary of the position, and it's a preliminary commitment. May or may not be binding. It should state that on there, but it generally outlines the basics of your job: compensation, vacation, CME, maybe some signing or relocation bonus. Very, very simplified. This is the time to get your team on board, whether it's us, whether it's somebody else. This is the time to have your professional on your side reviewing this with you, because you do want to start negotiating these terms. One thing I didn't mention at the site visit, and this would be applicable to any type of position, is that's the time, not the time to be negotiating pay just yet, because you want to be looking at the full picture. And so when you're looking at the letter of intent, this is your chance. If there are any gaps that you're not sure of, what does the malpractice look like? What are the benefits looking like? What is the CME going to be? Or what is the vacation time going to be? That's your time to determine if the whole picture is looking reasonable. Is this all making sense? Does this all look really fair? And do we need to negotiate these terms? Because once you sign that letter of intent, those terms are going to get translated into your contract. So it can be a little bit harder to renegotiate those on the backside when they think you're already on board with all of those numbers initially. Not impossible, but it just makes it a little bit harder. So you want to start off strong there. Generally in the locums world, and there might be different terms for different companies, but you'll receive something like a letter of confirmation. And that is the preliminary commitment or the offer that they give you for your assignment. And this is generally going to, I don't think we updated that language under there. I just noticed that it's the same as before, but this is generally going to confirm your dates, your location, your schedule, and it might be as specific as exactly which dates you're going to be there. If you're taking any time off in there, that might already be in the confirmation letter. They'll oftentimes already put in what you are going to have reimbursed. So whether it's your travel, your flight, your hotel, maybe they're renting you an Airbnb because you're doing a long-term assignment. They might even have that location. Everything gets spelled out in there. So that's a really, really very thorough, very detailed document that you will receive for your locums work. So it tends to, the process is a little bit different for a locums assignment than it is for an employed or an academic position, in that sense that you're not getting with your site, you're not getting a specific contract. You're getting this letter of confirmation, which essentially replicates your contract. You will have a contract between you and your locums company. That is a contract that will mirror the terms that we're going to jump into on these next few slides, that it's going to have more of your standard sections that you might be familiar with a little bit of a mix and match. So without getting too into the weeds, I'm always happy to at a later date. I just want to make sure everybody's familiar with those terms, and then we can kind of talk about the compare and contrast as much as possible. So a standard contract, I've seen them anywhere from 2 pages to 78 pages. They usually run in the 15 to 20 page range for an employed position. A locums contract is probably only going to be in that 2-page range, maybe 3. They can fit a lot of legalese into that. So it's really important. I really encourage physicians to make sure you are familiar with and comfortable with the terms in that contract. Whether or not you choose to negotiate any of them, or find that many of them are terribly negotiable, it's very important to know what that language is saying so that you know how that can impact your day-to-day life, both in the office, in the hospital, and at home. And so I'm going to focus on 5 of the main sections that have a kind of a heavy hit on the work-life balance. And so we'll talk about each of those. When I find terms that are applicable to locums, I'll try to highlight that for all of you. So the position and expectations section is essentially what you are agreeing to provide to the employer. So as an OBGYN, I might be providing clinic, OR, and call coverage. If you're family medicine, maybe it's something similar, clinic and call coverage. If you are in orthopedics, if you're in academics, maybe it's going to list your research. It should spell all of that out for you. And the goal is to have that as detailed as possible. And by that, I mean, not just saying full-time, but then defining full-time. So how many days in the clinic? Maybe how many hours is a clinic day? How many days in the OR? How many call shifts? Can we cap the number of call shifts? So if our group suddenly shrinks from 10 down to 5, we're not all taking twice as much call without having any say in it, or without having any additional pay. So trying to set some of those boundaries for yourself in the case that the group might change, the hospital might change, maybe there's a merger that changes things a little bit, that you have some protection and therefore some say in what happens to you and your schedule and your day-to-day life. So the goal is to get that as detailed as possible. This definitely applies to locums too. I mean, those letter of confirmations can get super, super, super detailed and really, really down to the weeds if you want them to. And so it's kind of nice to be able to state exactly when you're going to be somewhere and what you're expected to do on that day. From a compensation perspective, we're going to talk through the 3 main areas. So this is for most people, for most of us, especially if you're a resident or a fellow and you're going from that salary to an ascending salary, that is the first page that you turn to. Where did they list my compensation and my offer? Because that can be such a huge change. But we still want to make sure that it's the right number. You know, going from 50,000 to 250,000 sounds amazing, but if you should be getting paid 350,000, you definitely want to be on that end of things. So we're going to talk about couple different models, and then a couple different ways to know if what you were offered is fair. So salaried, RVU-based, and collections we'll go through. I'll spend a little bit more time on the salaried concept just because that is more applicable to locums in most cases. So the salaried is essentially saying you get a flat rate for the work that you're doing. So if I sign up to be a full-time OBGYN with a salaried model, it might just say you're going to be a full-time OBGYN for $250,000 a year. And that is just, they're going to divide it by 12 and that'll be my paycheck every month. They might offer a bonus. So something like if I produce over a certain amount, I might get a bonus. If I meet certain quality metrics, I might get a bonus. I might have that 250,000. And if I set my boundaries correctly and I said, hey, I'm going to take 50 call shifts a year, Based on that, if I do 51, each extra call shift is going to be reimbursed at whatever. So those are generally, that's a salaried model. Most new grads will see a salaried model for the first 2 to 3 years out of practice so that you have time to build your practice. And then some employers are just continuing with salaried models now. The group that I'm joining next year is all salaried. So we all get paid the same thing just based on how much time we're putting in. So that's a more common, you'll see that a lot in an ER department, like a 12-hour shift, it's going to have an hourly rate, or maybe it has a shift rate. And then this is the most common salary or the most common compensation model that you'll see for a locums physician. So it's generally, there's a lot of different ways that they can do this. So you want to talk to your rep or talk to other physicians who are practicing in your same field to understand what kind of models they're seeing. But I'll just give you an example of what I often see as an OBGYN. Is all of a flat rate for a shift. So say my clinic day is meant to be 8 hours. I get a flat rate for that. And then if I spend 9 or 10 hours there for whatever reason, I'll have an additional overtime rate. If I'm on call, I'll have a flat rate. And if I get called back in, so that would cover my 24 hours. If I get called back in, I'm getting paid an additional hourly callback rate. That's one of the most common ones that I see. I see a lot of just straight up hourly rate for locums for a number of different fields. So you just get paid for your time. And if you go 15 minutes over, you'll get a quarter of whatever your hourly rate is. So for those who feel that value for your time, it's a great model in that sense. So that way you can really know what you want, or know what you're going to be earning. Rarely in a locum setting are we using one of the production models, which are the next two that we're going to be talking about. I've never come across a locums contract that offers a production base. I'm not saying they're not out there, but I'm not aware of any out there as an independent contractor. So the RVU model is a work relative value model. So this is one of the production-based models that you might see in more of an employer setting, maybe an academic setting. The relative value units are a points system essentially designed by the Center for Medicare and Medicaid, where they assign a certain point value to each patient encounter that we have as physicians. So let's say I'm not using real numbers here, but let's say I do a level 3 office visit, and that gives me 2 RVUs. Versus then I go and do a C-section and that gives me 10 RVUs. Well, that's going to be the same regardless of what facility I go to. What changes is the employer's conversion factor. So how much your employer chooses to value that RVU. So maybe employer A is going to give me $45 for each of these RVUs, and employer B is going to give me $60 for each of those RVUs. We can see a fairly big range there, but that's of course going to dictate what you're taking home as your salary, in addition to how much you're producing. So understanding what to expect from that can be really helpful. We do see some tiered models. Some employers are just already setting those up. So they might say like any RVUs up to 5,000 are $50 an RVU. And if you then produce from 5,000 to 6,000, it's $60 an RVU, and 6,000 and above, $70 an RVU. So incentivizing you to work more, produce more. So those are some options that you can, if they're not already in your contract, try to negotiate. Otherwise, I am starting to see those across various systems who are using this RVU model. A collections model is more specific to a private practice. That's really the only setting that I've seen it in so far. Not to say that it's not elsewhere, but this is a little bit more complicated and can get a little bit trickier. We do have a whole PDF resource on this if you're looking for something along this line. And basically what collections is saying that when you see your patient and do your encounter and you send your billing code out, that level 3, well, it's going to go to either the patient if they're paying out of pocket, or the bill is going to go to their insurance and have to be processed. Maybe it's private insurance, maybe it's state insurance. As you can imagine, you might have different timelines on when you actually get the check back from that patient encounter. And those values might be different. So the patient, if paying out of pocket, might pay a different amount than the insurance would, might pay a different amount than if it were a private insurer versus Medicare or Medicaid. So understanding your payer mix can impact what your collections might look like. And things like whoever's doing the billing, how on top of it are they? Are they submitting these really quickly? Are they being aggressive to make sure that you get those collections back? Are they turning things around in 30 days, or is it taking 60, 90, or 6 months or something like that to get that? So that's important information to have. The other thing to know is that when you have a collections model, the check that comes back doesn't go 100% to you. You're working as part of a team in a facility, and you probably have some sort of overhead, whether it is paying MAs, nurses, maybe you and your colleagues are sharing renting a facility or paying a mortgage to have your office space and the equipment that you have in the office. All of that is part of your overhead. So if you can get creative and think of ways to decrease your overhead, you might be able to increase how much of that collections you get to take back. Are you taking back 30% of it? Or now can you clean things up enough to take 50% of it back? The other thing to keep in mind is there can be tiered models in this too. And so that could be something that you negotiate if it's not already built in. Let's say if you do more than 400,000 in collections, you can get, they're up to that. You would take 30%, maybe that 400 to 500 is going to be 40%, 500 above is 50%. Again, incentivizing you to produce more. So those are some ideas for those of you who might be looking at a private practice with a collections model. Quality bonuses are pretty common throughout the country. And so I want to just touch on those. These are basically a value that they may offer you as a bonus at the end of the year if you meet certain metrics. What's important to think about for a quality bonus is whether or not these metrics are within your control. So sometimes it's something you can absolutely control, like closing all of your charts within 24 hours. And sometimes it's something like your patient reviews, which if any of you has been to the physician recently, you might notice that you get your text, hey, submit a review, and you have 10 questions, and 1 through 9 are things like, how easy was it to schedule your appointment? How clean was the office? How pleasant was the front desk staff? And then finally, question 10 is, and how was your physician? And so if you're being judged off of all of those questions, you might have a little bit less control. So understanding how you're falling within these metrics, asking questions like, hey, of the other partners, how much of this bonus are they getting? Do they get the full, say, 30,000, or are they bringing home 5,000 or 10,000 at the end of the year? Just primarily so you don't budget to have an extra $30,000 in the bank at the end of the year and then find out that you don't get that whole thing. You don't want to be put in that position. And also if they're trying to use this as leverage and keeping compensation lower, you want it to make sense that it's actually going to be part of your salary. Evaluating pay. So this is where I was talking about the concept of how do you know if this is even fair? Is this $250,000 a good offer? It seems great relative to what I got paid before, but is my neighbor making $400,000 and doing the same job? So there are a few different ways that you can evaluate if pay is fair. And one of the best ways, kind of gold standard for that, is one of the survey data sets called MGMA. That is a survey data set. It comes out every year, usually around May, sometime in the spring, and it's based on the previous year's compensation data. And they get into the nitty gritty. They do it by region. Now they're doing it more by state. They'll narrow it down into specialties and subspecialties and subspecialties, you name it. They get really detailed with breaking down compensation through different practice types like multi-specialty, private practice, employed, rural setting, urban setting, really break it down, 10th, 25th percentile median, 75th, 95th percentile. They'll talk about collections. They'll talk about RVU. It's great. It's not accessible to an individual physician to just go access the full MGMA data set. So a company like Contract Diagnostics or somebody who specializes in physician pay will buy access to this. And then when we do a review with our physicians, we share that information with you, the part that is applicable to you. So that's how you can access that. If all you're interested in is the financial aspect and having that MGMA data, we have a product called Compensation RX, and I included up here because this might be helpful for somebody who's been in practice for a few years and has not renegotiated the terms. And now that you kind of don't know, like, I'm hearing different numbers out there. Is my income, does this still make sense? The model that I'm under, should I be asking for a higher salary? Well, this is where you can call us. We'll give you this data. We schedule a 30-minute phone call with you to go through the data, make sure that you understand all of that. And then you get that full report. So you can kind of decide how you want to negotiate that. Otherwise, if you're doing a full contract review, we're going to include that data. We do include, so another way that you can look at this is interviewing at a bunch of different places. So if you aren't exactly sure what you're looking for, you just want to see what the different offers are that are out there, go interview around. That's a great way to see what the options are. It might be a great way to find some leverage from one job to another, because you will be shocked to see how one job, one block to the west of you will pay maybe $200,000 more than the job 2 blocks to the east. It's really outrageous, the differences that you'll see. And maybe they make up for it. Maybe there's a reason. Somebody has a great benefit package on one side, or huge amount of vacation time or something like that. But we do realize that interviewing a number of places is a bit of a burden and takes a lot of time and coordination, and pulls you out of the office or out of your residency program maybe to accommodate that. And so at Contract Diagnostics, we do keep all of our internal data available, and we make it anonymous, of course, to share with you. So if you say, I just interviewed for this one job and I just want to know if this one job is fair, well, not only will we give you the MGMA data that we have, we are also going to provide you with all of the applicable data to anybody else whose contract we've reviewed in your field, in your location, what their signing bonuses are. We want to share that with you as well, because that's going to be real time. And then it saves you from interviewing in all of those places. You'll get to hear what some of your colleagues are being offered in your neighborhood. And then just to keep in mind, you know, one job, it's not always going to make sense to get the first offer. Like you might have a niche, you might be offering something really unique, another language that you're speaking. Maybe you're building up a research department. Maybe you're starting or growing their global health department, you name it. The story that you're bringing in really matters to what might make sense from the contractual standpoint. It can matter if you're looking at a rural place where they've been trying to recruit for 2 years and you're the first person who's been recruited there. So 250 isn't 250 isn't 250, you know, each position is going to have room for negotiation, because there is so much more to the picture, to the story, that can help us provide leverage and provide negotiation tactics as we're looking at all of this. Oops. And that's just a reminder, don't forget to raise your hand that, like I was saying, if you've been in practice for a little while and it's been a couple of years since you've negotiated, by all means, let's figure out how we can get you a better deal. There are some other sources of income that are out there. So nurse practitioner and PA supervision, if you're doing research, teaching, academics, maybe you have some side gigs. So those should all, if they're going to be additional time, if they're going to be additional administrative or clinical burden for you, should be compensated additionally. So please do make sure, if you're seeing those in your contract or anticipating these to be part of your job description, confirm that you have these also supported for income. From a locums perspective, you should not be restricted from other positions. So that's really important to confirm when you're looking at a contract with a locums company. Generally, they're fairly straightforward, fairly simplified, and fairly non-restrictive in that sense. But you do want to make sure that they are not restricting you from working with another locums company, from working another site at the same time. You should be able to work multiple locums positions at the same time. You can work with different locums organizations at the same time. You could have your employed job plus your locums job. You could do something like I do outside, you know, working as a physician educator. That should all be available to you in a locums contract situation. And if that's something you want available to you in an employed situation, do make sure that you have that protection in your contract, because sometimes they will restrict. Benefits have a huge dollar value to them. If there is a strong benefits package, you're probably looking between $30,000 and $60,000 worth of value between your health insurance, your life and disability insurance, vacation, CME funds, retirement plan, retirement matches. These are fantastic. But make sure they're there and make sure you understand how they work. So I always recommend when you are interviewing with an organization to ask to meet with or just call their HR department and ask for one of them to spend 45 minutes or an hour just reviewing all of these benefits with you in detail and get as many questions answered as you can so that you understand what the employer is going to be providing for you, what kind of premiums you might have to pay to achieve the coverage that you want. If there's any delay in like when you can start investing in the retirement plan, can you do it day one or do you have to wait a year for some reason? Those are all things to be aware of. If they're prorated, if you are doing a partial year, or if you're on a maternity leave or an FMLA otherwise, how is that going to impact all of it? When it comes to locums, you're pretty much going to need all of this on your own. So I have done almost exclusively locum tenens for the last 3.5 years. And it's a bit of a learning curve to figure out how to achieve all of this. But yes, you do have to buy your own health insurance, whether it's going through a partner or going on the marketplace or going into a private plan, your own life and disability insurance, which we do always recommend that physicians carry their own life and disability insurance. You've probably heard that before. Your employer is most likely hopefully going to provide that for you, but it doesn't guarantee that they are offering a particularly robust policy, and it doesn't continue with you. So when you switch employers, you're going to lose that disability policy. If you carry your own, then you know you're going to have that no matter what. Retirement plans, as an independent contractor, you're going to be looking at an individual 401k or a SEP IRA, and those are going to have different limits than what your standard 401k might have. Vacation time is going to be when you pick it, and it's not paid. So if you're not working, you're not getting paid. Those are key things to keep in mind. Your CME, that's all coming out of your back pocket. But we'll talk a little bit about how you can recoup some of those costs. In terms of, now this is going back to anybody who is still employed. If you have been in practice for a few years and nothing has changed in your contract, that is a good time to make sure that you are reviewing it and maybe negotiating terms to update them. Your salary should go up on a yearly or every other year basis. And if you've gone more than that without a change in salary, it is time to have that conversation and figure out, hey, where should it be? How can I get it there? Why haven't we touched it yet? And what do we need to do to make sure that it's back to where it needs to be? And we can help you with that. I mean, looking at what kind of production you've been on, what kind of departmental roles you've been holding, maybe directorship positions, you name it. Like, we can put together that whole picture with you to help make sure that you feel like you have a strong package going into that conversation with your team, because we know everybody tends to feel a little bit anxious about that conversation. We want to highlight how wonderful you are and make you feel like you're ready to share that. All right. And then when it comes to compensation, sometimes you look at the number and the first question doesn't have to be, hey, I want to take this 200 to 250. It can just be asking for more information. So this is another PDF resource that we have for physicians. It has a bunch of questions that you can ask about just how did we get to this number? How often is it going to be evaluated? What does it look like for other partners? What happened during COVID? What changes if I do additional call? Questions like that. And when you get those answers, that's your opportunity to decide, you know what, I think that was a really well thought out offer, and I think this seems fair and I'm happy with this. Or, you know what, I think based on that, I should be asking for an additional however much. All right, so I'm going to sip water for 1 second. A couple other areas I really want to spend a moment on highlighting. Malpractice insurance is one of those. So 2 main types of malpractice insurance. The gold standard is occurrence-based, and that is basically saying that as long as you are working for your employer, as long as you are under this policy, you are protected for any patient that you saw under this care, under this policy. So if you see them today and in a month you get a claim from a patient, well, then you are covered. If you see them today, you leave the job in a year and you get a claim in 2 years, you are still covered. On the other hand, with a claims-based policy, you are only protected when you are working for the employer under that policy. So if you see the patient today and you hear back from them in a month and you're still employed and you're still under their policy, you are covered. If you leave in a year and you hear from them in 2 years, you are not. And that is where your tail insurance comes in, and you do need to have tail insurance, and that helps protect it, essentially turns it into what appears more like an occurrence-based policy. Most locums companies, as I understand it, and you always ask about malpractice, make sure that is included. That should be provided by your locums company. Most of them will include claims with tail, and they should be able to give you proof of that coverage. If you're working with an employer and they list that they have a claims-based policy, then you need to ask about the tail coverage. Who's paying for that? If they're expecting you to pay for that, what can you do to negotiate it? So can you say, no, let's have you cover that. Let's negotiate that one in. That might be possible. If they say absolutely not, you can do a few things. One, I always recommend getting a quote so that you know what to anticipate for that tail insurance. And then ideally throw that amount in a high yield savings account or something you can access in the case of leaving, so that you're not scrambling to put together a 5 or 6 figure check when you're not expecting it and you're already going through a change. You can also get a little creative, saying things like, hey, let's do a retention bonus. If I'm here for 3 years, why don't you give me a $60,000 bonus? And then you can take that money and put it in that account so that you're prepared for paying your tail when you leave. Or maybe in 3 years, they'll pay half of your malpractice insurance. And if you stay for 5 years, they'll cover all of your tail insurance. So those are a couple of different ideas, but do make sure you understand what kind of malpractice insurance is provided. And if it is claims only, have a good, clear plan for yourself as to what to do about tail. Restrictive covenants I highlight because they can have a big impact on providers. So I do not mind bouncing around from one city to the next or from one state to the next. So a non-compete is not going to have a big impact on me. But this is a restriction that is put on you after you've completed your employment. And so a non-compete will say that for the next 2 years after you leave the job, you may not practice within a 25-mile radius of maybe every clinic or hospital that you worked at with this employer. As you can imagine, if you had satellite clinics, if you had multiple hospitals you were covering, these could be like huge areas that you're blacking out. And if you're not somebody like me who likes to move around, you might have picked your location for a reason. You might be born and raised there and plan to live there forever. Maybe you have a partner who is really committed to that location and you don't want to be blacked out of working in your community. Well, it's really important to think of ways that you can try to minimize that non-compete. Depending on your employer, these can be very challenging to negotiate. So sometimes you have to get pretty creative. One way, sometimes you can shrink the radius or you might be able to shorten the time. Those tend to be a little bit trickier. But another thing you can do is try to limit the number of locations that they select for your blackout area and just say your one primary location, have that named. Maybe it's your primary clinic or your primary hospital, and you can't work within 25 miles of that. Well, at least you know it's just that one radius and we haven't created 3, 4, or 5 areas. The other thing that we've had a lot more success with is as different job roles come up within each of our fields, you might be able to create exclusion criteria. So for example, as an OBGYN, we have a role as laborists or hospitalists where we don't have our own clinical practice anymore. We're just covering whoever walks through the door. And so we've had success saying, okay, I'm not going to be a full scope OBGYN, but I'm not breaching the contract if I work as a laborist for those 2 years, even within that radius. So that's been successful. I negotiated something like that with a nephrologist who was able to create an exclusion if she worked as a general internal medicine hospitalist. So she just couldn't do her nephrology work within that radius. So if you think a little bit about your field and maybe there's an area that you would be comfortable with practicing within that radius, that's a great way to do it. Some people actually do use locums to ride out their non-compete. So they'll find a job that maybe they're flying to, maybe you're driving an hour away, something outside of your radius. For those 2 years. And that can be a great way to get familiar with the locums world and also to ride out your non-compete and maybe have some additional flexibility and benefits during that time. There are certain states that do not uphold the non-competes, like California is known as that one. So be familiar with your specific state restrictions. federally, Biden is trying to limit or eliminate non-competes. It stands to be told whether or not physicians are going to be protected under that. So we don't know yet. If that clause is in there, please do take that seriously and determine if that is something that's going to matter for you. You don't want to breach the contract and end up with like a humongous fine or something like that. Non-solicitations are saying that you're not bringing your coworkers or your patients with you. So pretty simple for that same amount of time. With locums, generally your non-compete is going to come from the recruitment company that you're working with. So if I use a company to present me to a site, I will now, and it depends on your contract, but you will generally have a non-compete with that particular hospital for the next 2 years. And so if you try to take a job with that hospital, you would either need to do it through the locums company, or maybe they have some sort of buyout that they already negotiated with the site where you can, yes, you can be employed with them, but you or the facility might need to pay the recruiter and the locums company kind of as like a finder's fee. The other thing is if you start working with that locums company and in 6 months, you're like, oh, I don't really like this locums company. I want to work here. I love this site, but I want a different company. Well, you're going to have that 2-year restriction. So you're not going to be able to make that switch. So that's pretty much as extensive as the non-competes get. That is something that you can negotiate if you feel like that is going to be prohibitive for some reason ahead of time. That is something that you can talk to your recruiter and say like, hey, these are my concerns. How can we clarify and negotiate this language? Termination, although most of us are not starting a job already thinking about ending it, unless that was the intention with the job, it's really important to think about what it takes to terminate and the costs of termination. So most jobs will offer a without cause termination clause, which basically just means you can have a reason in the back of your head. You don't have to tell anybody. You just write that note, send it via priority mail or however they want you to get it to them and say, my last day will be December 31st. And what's important to make sure that you know is 1, how to deliver that message, and 2, how much notice you need to give, whether it's a 60-day notice, a 90-day notice, a 120-day notice, that you're giving the appropriate amount of time. For a locums contract, most commonly, this is a 30-day notice, which if something isn't working out and you want a quick change, 30 days might be great. If you were loving the assignment and you got a 30-day notice and didn't have anything else lined up, 30 days is a very short amount of time to find your next assignment, to get licensed or credentialed in a new location if you don't already have a second spot lined up. So you can think about that as you're looking at those termination clauses. We have with COVID seen more restrictive language and possessive language in some senses. The facilities, these employers are starting to put language in like for the first 2 to 3 years of your employment, you can't give a without cause termination. They would have to breach the contract and you would have to highlight that and they don't fix it for you to leave or catch somebody on a day of weakness where they're feeling willing to let you go. But otherwise, you may be stuck there for that amount of time. Some of them are requiring a 6-month notice. This is important to know because you want to think about how this is going to impact your life. If something's not working out, what is it going to take to leave? 6 months can be a really long time if you feel like, even though you listed this without cause, this isn't a good place for you, or you have somewhere else that you need to be with family or something along those lines. So do think about those clauses as you're looking at it. In terms of cost of termination, that's where the tail insurance that we talked about can come in. That is also where if you get a student loan repayment, we're seeing that offered a lot of places, a signing or starting bonus, a relocation bonus, a lot of those bonuses may be need to be repaid if you terminate before 2 years, 3 years. I've seen one as long as 6 years. So that's important to know as well, that you're prepared to pay back a signing bonus, a starting bonus, whatever, $40,000, $50,000, whatever you got. If there was a student loan repayment, that might be $75,000. A lot of those were taxed when you originally received them. So if you had a $30,000 signing bonus, you might have only gotten a check for $15,000 or $18,000. But now if you have to pay it back in full, you have to come up with an additional $12,000 to $15,000. Ideally, they're prorating them. So if you get closer to that 2 or 3 year mark, you're paying that much less. Most of them will prorate, but some of them are expecting a payment in full. So certainly try to negotiate for that prorate. But being prepared to leave. So, there's a lot of change. There can be a lot of stress. Try to take that amount out of it by knowing what to expect and how much you'd have to pay and being prepared for that with that savings account. When it comes to accepting risk, this is where it's just important to know your goals for yourself, for this job, where you're willing to give and take a little bit, because the employer, they're always going to have their non-negotiables. Like, nope, this is what this means. We will not change it. We don't budge. We put our foot down. It's okay for you to have that too. You can have non-negotiables. It's just important to know what those are and where you feel comfortable finding some compromise. Like, hey, I'll give a little bit on the compensation if they're going to loosen up this non-compete for me, or maybe I'll take a bump in my salary for a difference in vacation. Think about some of those different areas and what really matters to you, so that you feel comfortable with the contract that you ultimately agree to. When it comes to negotiation, a BATNA is the best alternative to a negotiated agreement. So generally, I always recommend when you're going into a job, try not to be desperate for that job. You want to be, even though, especially when we're working with our physicians, if you want to be there, we want to get you there. We want to make sure that we can negotiate an agreement that you feel great about. But I also want you to feel comfortable walking away if you find that your values and the values of this job are just not aligning as you're going through this. And it's important to have a backup plan, whether that is backpacking in South America for 3 months because we didn't do that when we were 21, or if it's doing that job a couple blocks to the east that you looked at and thought like, hey, that'd be a good backup option if this one doesn't work out, and or anything in between. Maybe it's taking your boards, maybe it's having a baby, whatever it may be for you. And sometimes when we're negotiating, we don't necessarily always need to be asking for something different. Sometimes we just need to be clarifying. These terms look different from one hospital system to the next in the way that they phrase their legalese. And so it's just important sometimes to understand what point are we trying to make here? And is it clear enough? Is anybody who reads it today still going to read it like that in 3 years if we have a full turnover of the admin team or something like that? Is it still going to be clear? Or do we need to negotiate some new terms to make sure that this is more clear, that this is more protective for you? Your negotiation strategy can be a little bit different between academic group versus hospital employed versus private practice versus maybe locums. And we as specialists are very familiar with a lot of those differences. And so we're happy to help you navigate where you can negotiate and where you might just be hitting your head against a wall and they're not going to budge. And you're really trying so hard, but we need to redirect that energy to get you something else that is more in line with what you're looking for and with where they're willing to give. Sometimes we can get addendums in our contracts. Oftentimes that's how we can personalize them. An employer might say, oh, this is non-negotiable. This contract, this is standard, this is non-negotiable. That doesn't mean, one, that you shouldn't have it reviewed, because you still want to know. It doesn't mean that it means it's fair. It might still have some clause in there that you're not comfortable with. But that standard agreement might not be negotiable. You might not be able to change the language in there, but it doesn't mean that you can't clarify or personalize in an addendum or an official letterhead that's included with your contract. So those are areas where we can help you make sure that you're getting the terms that you feel comfortable with and that you like. And then once you're in a group, if everybody has the same contract that they're working under or wants to get under the same contract, definitely power in numbers. We do group negotiations as well. And that's a great way to help improve your situation as a team if you're willing to go into that together. I guess I mentioned this a little bit, but with a locums contract, I did say, so those are pretty simple contracts generally. They're not meant to be overly burdensome to the physician, but there are certain areas that physicians may or may not feel comfortable with. Or when you're working specifically with a site and you're looking at dates, you're looking at rates, you're looking at what gets reimbursed and what doesn't. That's all negotiable. So by all means, you have an opportunity as an independent contractor working with a locums team to negotiate those terms. Your locums rep should be able to help guide you with all of that. You just have to be able to voice what you're looking for so that they can help you negotiate those terms. When it comes to locums, since we're on we're working with Weatherby here tonight, locums has become increasingly needed over the last few years, especially. It's always been around. A lot of physicians were using it previously. They'd do their job and then they'd pick up some weekends or holidays here or there for some extra money. Maybe it was to pay a mortgage or to help put a kid through college or to go take another vacation or something like that. Now we're seeing a lot more physicians doing this as their full-time gig. That's the only clinical work they're doing is all in locums. And that was what I did for the last 3.5 years and absolutely loved it. So there is a significant increase in the use of locums. Just from when I started in 2019, I would say the first time I went around, there was something like 25 jobs I could choose from. Now I look at the board and there's like 100 some jobs with any one locums facility. If I put all the facilities together, I couldn't even tell you how many job opportunities I would have. There's a lot out there. So there's a huge need for locums physicians. It generally pays a little bit better than an employed position. However, it is 1099 income, which means you get the full check. You do not have any taxes, anything pulled out, which means you have the responsibility to pay your own federal taxes, state taxes, your own Medicare, Medicaid, Social Security tax that's not being paid by your employer. So it does come with a little bit more burden, a little bit more of a learning curve for you. It can have pretty significant financial advantages, though, if you are, calculating everything correctly and make sure you're staying on top of everything. Some people use locums to determine if something's a good fit for them. So if they say, hey, do I really want to move from Wisconsin to California? You know what? I'm going to take a locums job first. I'm going to check out the area. I'm going to check out the team. Do I like working for this system relative to the last system I was with? And that could lead to a permanent placement. So sometimes they are placing physicians there with the intent to hire you. That is an option. So it's a great way for you to kind of try out for the position and let them try out for you as well. It's also a really fun, flexible way to see different places. Since I used locums as my full-time job, I moved essentially to those locations. I had full-time housing there. I had a full scope practice. I joined a gym. I found my running trails. I found my community. I hung out with my coworkers. Like, it was such a cool way to see different parts of the country. So having grown up in Wisconsin, to then spend a year in Washington State, and then a mountain town in Colorado, and then a mountain town in Utah. And I mean, I spent almost 2 years at my last assignment. It's like a home essentially. So it's a really, really cool way. Some people like to use it to do like a week on, a week off, or 2 weeks on and 2 weeks off. So you can vacation, or you can know that you're home with your kids at a certain time, picking somebody up from school. So people have some pretty compelling reasons for doing locums that you can oftentimes meet some of those needs that you have for the time away from work, in addition to the work that you enjoy doing. There is a difference. So I was talking a little bit about W-2, which is employed work, versus 1099 or independent contractor works, just so you're familiar with some of the basic differences. We do have some blogs and PDF resources on this that I'll link to at the end as well. But with an employed position, most of you are probably familiar with that. Your employer is pulling your tax money out. They're covering half of your Social Security, Medicare, Medicaid. They are offering a 401k plan or 401a or some sort of retirement, and maybe they're giving you a 3 or 6% match. They're giving you all those benefits like that health, dental, disability, life insurance, paid time off, CME. So you can get a lot of benefits by being a W-2. What you do not get are much in the way of write-offs. So they take all of that out. You don't get to try to find many other ways to reduce your tax burden. On the other hand, as a 1099, you're an independent contractor. It's like you're your own business, essentially. So they're just giving you, if they said they were paying you $150 an hour and you worked for 1 hour, you will get a check for $150. Whereas your W-2 counterpart might have a check for $75. You still have to pay your taxes. You are now paying your full Social Security and Medicare tax. You're not having a part of that paid by your employer. You do not get a retirement plan from the employer, so you are responsible for setting up your own retirement plan. That can be beneficial because you can oftentimes put more into those than you could into, say, a 401k. So that would be something you would talk to your accountant about. You set up your own health, dental, disability, and life insurance. Those can all be write-offs. So can your car, can your mileage, can maybe your groceries. There can be a lot of write-offs that can help reduce your tax burden when you do offer 1099 work. Your accountant would be the one to determine, like, yes, this one applies, no, this one doesn't. What's the best way to keep track of everything? Because it is a lot of, if you want to get all of those, it is a lot of like record keeping on your part and keeping track of all those receipts and folders and numbers and all of that. But it can be hugely beneficial to help you drop tax brackets if that's something that you're interested in. Because you're responsible for all of those benefits, generally your compensation should be higher than a W-2 counterpart. So usually I estimate about 30% higher. So I don't know, I can't do that math in my head, but maybe if your W-2 position was 150, then your independent contractor position should be more like 200 an hour. Red flags in a contract, I could summarize all of these into, if it's too vague, then it needs to be better clarified. So something to keep in mind there. Resources, reach out to us. Like I said, we have tons of blogs. We have PDFs that are all free. You can email us, set up a free consultation. And then I also love this book by Chris Voss, Never Split the Difference. He's a former FBI hostage negotiator, and he is really great at applying everything that he's learned to other areas of life. So you can take that to your next job. These are a couple of QR codes that I thought you might find helpful that are specific to today's talk. Our independent contractor Q&A, again, so you can read a little bit more about 1099 versus W-2, what to expect. And then a couple of the blogs that I've written that are a little bit more specific to different practice types, including locum tenens. We do hear a lot of physicians say that they wish they had talked to us with their last contract a few years ago. So we hope this catches you ahead of the curve. It gives you some extra education. And then we'll jump into a Q&A. And I realized that went a little bit longer than I anticipated. Oh, it looks like the Q&A, we've been answering a lot of those in there. So
yeah, Dr. Catherine, I did answer one of them, but I thought you might have more experience with one of them than I know. And it was on nurse practitioner or PA supervision and how that may differ from a locums position from like a standard employed position. If you know, can you comment on locums and their ability or willingness or desire to supervise PAs and NPs, knowing that they're really cranking on? I read a report by A&M Healthcare earlier this year, and it was like the number of searches that they've done for APPs has been skyrocketing lately, as well as their salaries. So if you could comment on that. And also then, of course, one of the questions that I would think of is there typically additional compensation for a mid-level provider supervision? And does that vary depending on a locum's position or a standard employed position?
Yeah. So for a standard employment position, what you think about when you're supervising a mid-level provider is you are going to be having additional time. If you have to do a full read through their charts and sign off, that's going to be additional time spent. It's going to decrease your productivity. If this is during your clinic day, it might limit the number of patients that you can see or the number of surgeries you can do. And it can also increase your liability, especially depending on the state that you're in. If your name is then on the chart, that is going to increase your liability. So generally that should be compensated. And if it's not specifically separate from that, it should be factored into your overall compensation. As a locums provider, you generally should have the option to say, I will or I won't. It gets pretty detailed what your job description is going to be when you're working at a particular site. So if you don't want to be supervising mid-levels, you don't have to be. So for an OBGYN, maybe I worked at a lot of sites with midwives, and I had to make the decision as to whether or not I would be supervising those midwives or not supervising them. You might have that in different situations for different fields that you're in. But that is a conversation that you can absolutely have ahead of time. And you have a lot of protection if you get there and you didn't realize you were supposed to be negotiating. You go to your rep right away, and that should be fixed almost immediately if that's something that you're not comfortable with or needs further clarification.
How often, this out of my curiosity, how often do you keep in contact with your locums rep? And I don't know if that varies by organization. I know you've worked with Weatherby in the past, and I'm just curious as to how often you reach out to them, they reach out to you, about what that relationship is like.
Well, once you are interested in a particular site up front, you're probably going to be talking to your rep quite a bit, trying to hone out the details, the living arrangements, the reimbursements, make sure you get your compensation rates down pat. Once you start there, a few things might show up that you weren't anticipating. So in the first week or month, there might be a lot of back and forth, like, hey, they didn't mention this, we need to get this in the contract, or hey, I want to make sure, it looks like I'm getting called in after hours a lot. I think my overtime rate is too low, whatever that is. I would say the last contract that I had, where I was there for almost 2 years, I was in touch with them quite a bit up front. And then every 3 months or so, I'd get a quick text like, how's everything going? And then I would renegotiate. So something for all of you to keep in mind, if you are doing locums and you stay somewhere for a longer amount of time, as you get to know the position better, I renegotiated my rate every 3 months, pretty much. And so that's something that you would go through your locums rep additionally. If everything's going really smoothly, you're happy with your rate, you're happy with location, nothing needs to change, you'll probably just get those quick, like, thumbs up kind of check-ins. If there's a concern, you will be in touch with them regularly. And then, as many of you know, you probably, once they have your information, you'll hear from them all the time by phone, email, and text.
But yeah, I know of some physician recruiters, and from what I've heard, once they place you in your job, they're kind of like, okay, I'm on to the next candidate so I can get another placement fee. It sounds like the locums reps, if you will, are a little bit more looking, more in contact with you, and making sure that you enjoy it. And if you don't, then finding you a new assignment and everything else. So
yeah, they're definitely your go-to point person. And you stick with the same person. Usually once you're in a company, they won't have you bounce around unless that person leaves for some reason.
Do you know, I guess this is just a general question, if the audience doesn't have any, I just have one. Is there a standard, we see stats all the time about physicians taking jobs and how many of them leave their first job out of training within a year or two. Are there stats with the average locums assignment? And I guess it probably varies by specialty and by location, but are there stats on like the average assignment is 2 months, 2 years, somewhere in between?
Madison might actually have that data better than
Or
I do.
I guess maybe, if you don't know.
Like my experience, I see them all across the board. I see things as like the same sites coming up just for like a holiday coverage, because they probably only have 1 or 2 docs and somebody wants off. And I see a ton of sites that are looking for full scope clinic 5 days a week and 1 in 3 call. So I think there's everything is out there. It's like something for everyone.
Yeah.
Yeah, and that's really true. That's what we see on our site as well. I will I'll add a link in the chat for everybody to take a look at. We have a State of Locums report that has a lot of interesting information on things like that, about how frequently people are entering, the locums market, how long they typically work locum tenens, how early in their career, late in their career. But yeah, I'll add that information as well. Well, I know we're over time, so I just want to thank our experts just one more time. Thank you so much, John, and thank you so much, Dr. Catherine. You are wonderful. We just really appreciate all the information that you guys shared here today. Everybody who attended will be getting an email to allow them to rewatch the webinar. We'll also have some additional resources there that Contract Diagnostics shared with us today, so please look out for that by end of week. And if you want to have more conversations with Weatherby Healthcare or Contract Diagnostics, that contact information is here, or you can reply to our email after the show. So have a great night, everyone. Thanks so much.
Thank you, Madison, for inviting us, and thank you everybody so much for spending the evening with us. Reach out with any questions. We're here for you.
Thanks so much.